with this country. So I know that this meeting is the only thing standing between you all and your long weekend coming up. So we shall not tarry. All right, are there any adjustments to the agenda? Any additions or changes?
Yes, ma'am, Madam Chair. I have one addition to the agenda in the form of a budget amendment. So that will make a total of two.
Two, okay, so noted. All right, if nothing else, I'll entertain a motion to approve the agenda.
Motion to approve.
Second.
All right, roll call vote.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Oh, he'll be late, but he will be here.
and Mr. Curtis is not going to be here tonight. Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown, Commissioner Alam,
Josh Brown's good.
and Mr. Gregorio.
Yes.
Thank you.
Okay, motion carries. Okay, hope you had a chance to review last month's minutes that were sent to you in your mailings. So if there are no adjustments to the minutes, I'll entertain a motion to approve.
Motion to approve.
Second.
Okay, roll call vote.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, late, Mr. Curtis, excused, Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
Thank you.
Okay, motion carries. Are there any public comments?
No, ma'am.
Okay. All right, any staff and/or program recognitions?
I do want to recognize two individuals. Of course, we want to recognize Liz Stevens and Marissa Mortarboy for their service to NCPHA. We did have our first official meeting, and they were a part of it. So it was certainly delightful to see them getting involved and not sitting on the sidelines. As mentioned previously, Marissa is our at-large member, and Liz is actually the chair of the nursing section, which is a huge section.
Oh, wow, yes,
of PHA.
yes. Yep. And you're president, right, Director Jenkins?
That's correct.
Okay,
So
Very good,
we're
very
making
good.
it a family affair.
yes, Durham is leading. Durham is leading. Thank you for doing that, because that's above and beyond your regular job. So you all represent us very well. Thank you. All right, so our presentation this evening is coming from environmental health. So Mr. Salters is going to give us some information and educate us on that whole process of all these food trucks around and what it takes to make sure all of those get certified and keeps the community safe. So I'll turn it over to you.
Yes, Chair. I'm not seeing the option to share my screen yet.
Okay.
Wait a minute, let's see.
Should be able to do it now, Chris.
Okay, let me try again. There you go. Okay, are you seeing that screen now?
No.
I'm sorry. How about now?
Here it comes.
Okay.
Now we do.
Okay.
Yes.
Things are moving a little slow.
Okay. Let me give a quick disclaimer before I get started with this. There are a lot of slides in this show, but we will not be spending a lot of time on many of them. There are some video links that I added to a lot of these slides that I hope the board had a chance to open. A lot of them are really cool. There's a lot of really, unique and cool information inside of these links. And there's some, a lot of it centers around Durham County. Durham County is the epicenter for mobile food units in this state. And I'll explain some of that and the history of mobile food units throughout this presentation. We'll touch on a few other things, but we'll go ahead and get started here. And first off, talk about why we regulate these mobile food units. The general statutes or North Carolina law 130, General Statute 130A-248 actually covers what we're supposed to regulate with regard to food service operations in North Carolina. How do we do that? We use administrative code sets. So Chapter 15A of the North Carolina Administrative Code, subchapter 18A, the set of rules is called, we refer to it as the 2600 rules. Those are the rules that we use to regulate food service establishments with. Now, in 2012, we also, per reference, the 2600 rules adopted the North Carolina Food Code Manual. And that is where the gist of the rules comes from. That is the primary tool that we use in regulating all food service. There is a special section in the 2600 rules that refers to mobile food units and push carts. But that food code is that's the primary tool that we use in regulation. I put this slide in here and hopefully y'all had a chance to look at this. There's some interesting information here. I just wanted to share that if you look at these highlighted sections up here, those are permit numbers. And that 40 starts environmental health permits, but that 32 that you see, that's a unique identifier for Durham. So all permits that you see with that 32 in it are Durham County permits. The next two digits, in this case, 01, refers to the establishment type. If you look back over at this list, you'll see restaurants are number 1. So that 01 means that this is a restaurant and it's the DeBose House and Bar, which is actually over in Chapel Hill, but it's still in Durham County. And the last 4 digits are the unique number of that permit. 1884 is this permit number. And to just to give you this slide is also here to give you an idea of all the different types of establishments that we regulate. If you look at this other permit number over here for Tattoo Asylum Jackson Herritt, if you look, it's still 4032 Durham County permit, but you see that 61. If you come down this list and you come to 61, you'll see it's a tattoo artist. The other takeaway from this slide is this. I want everybody to pay close attention to this. We have 1,945 establishments here in Durham County that we're responsible for regulating. That equates to 4,915 inspections per year. And that does not count visits. It does not count verifications that we have to do. And it doesn't account for all the temporary food establishments that we end up permitting because we just don't know from one year to the next how many there are. Why would you start a mobile food unit versus a restaurant? It's simple, it's money. It costs a lot less. The failure rate for a mobile food unit is much lower than a restaurant. Plus, you get to test areas that you can't do with a brick and mortar. You're mobile, you move around, it's obvious. The history, this is another example of something I'll move through pretty fast. This is an example of someone noticed that people were looking for fast food around the airport and it wasn't there, and they found that they could stop at a location close to the airport and make good money by doing that. But if it didn't work out for them, what would they do? They just pull up anchor and move on and find another location that did better for The link that binds the mobile operator to a commissary is found in the 2600 rules, 2670 general requirements for push carts and mobile food units. The key takeaway here is push carts or mobile food units shall operate in conjunction with a permitted commissary and shall report at least daily to the commissary. So they have to have a home base, which is a permitted location. In the beginning, was real simple. You had a restaurant that had a little bit extra space, and they went in and they cleared out some space in their cooler, and they made some special time for a mobile food unit to come in, and they allowed them to operate there. You didn't see more than one mobile food unit. Sometimes a mobile food unit push cart, but you rarely saw more than one in a restaurant. Just so that you know, what is a shared use kitchen? Well, shared use kitchen is where you have multiple, it's kind of the same thing as commissary, not exactly, but it's pretty much close in by definition. And what it is where you have a lot of operations under a single roof. The term incubator kitchen, it was coined in that some of these commissary shared use kitchens are places for somebody to come in, has an idea, they've got some niche that they're trying to fill with food service, something that they do better than everybody else. They come into a shared use kitchen and they start a catering business. They start a special events business. And as word gets out and their business grows, they move out of that incubator kitchen into a brick and mortar of their own. So it's just a place for them to get started. I hope everybody had a chance to look at this link. It's pretty cool. A lot of these mobile food unit operators get very creative as to where they operate from. Some of them are in hotels, some of them are in churches, church kitchens. Some of them are in Lions clubs and places like that. This concept began in Durham County. Okay, there is a place in Durham County that's an event center / shared use kitchen up on Chapel Hill Street called the Cookery. The person who started this had the idea that he wanted one of these in every county in North Carolina. He still only has the one here. When the state stepped in and started looking at this concept, they had no idea how to regulate it. And we bounced back and forth about how to permit, who was responsible for what. And finally, we got where we are today, but it all started in Durham. This was a problem, and this is one reason why Durham County became the epicenter for mobile food units. General Statute 138-248, paragraph C said, upon issuance of a new permit or transitional permit for an establishment, any previously issued permit for an establishment in that location becomes void. A lot of counties, including one of our larger neighboring counties, hung their hat on this and said, we're not going to allow shared use kitchens. But in Durham, we did because we're business friendly and we wanted to try to help people get established. And we allowed the commissaries to open. They started here, and that's why Durham County is the epicenter for this. Now, in 2015, that the AG's office always said, we don't think that's what the general statute actually, the intent of it, what it actually means. But in 2015, Session Law 2015-286 added this verbiage, and it says, basically that issuance of another permit does not void previous permits in that location. That opened up the doors to force other counties to also permit commissaries. This is a great link. If you look at this link, this video, there's a young lady in this video who keeps talking about this was a major commissary that opened up in Durham. It was originally called Will and Pops. It's now the Kitchen Archive. And they have 50 to 60 operators working out of that location. Some of them include Department of Agriculture operations, but the vast majority are permitted out of Durham by us. She keeps referring to in this video, this is going to do so much for the Raleigh food truck scene. So for a long time, a huge majority of the mobile food units operated in Raleigh and Wake County were permitted out of Durham, and a lot of them still are. This is what I refer to as a station concept. I'm gonna move through these slides pretty fast, but where this came from, this started in Durham as well. An commissary operator came to us, and he had this idea of using a warehouse, and he wanted to have, he had a number of mobile food units that he wanted there. And he said 45, I believe. And we kept looking at it, and all the problems that having that many operators in one location creates started me thinking about this station concept. And I told the guy, I said, look, why don't you just create stations? Because operations need space based on how much food they make, the volume, the types of food, and their processes. So why do you care how many are there if you rent out all of your stations? So one operation may need one station, one might need 3, but why do you care if they're all rented out? And he latched onto that, and he started this. So that was when there was nothing there. This is what it looks like when you walk into that commissary now. And you see how busy it gets, see all the stuff that is in there. Like I said, there's like 50 to 60 operators in this one location. And this is an operation, this is just a warewashing operation. You see the racks, everything up on this shelf is turned upside down to air dry. 3-compartment sink, see these massive hot water heaters. And this isn't quite finished. There's another stove in this location now, but that's shared cooking space. This is a walk-in cooler. One thing to take away from this is when you got multiple people storing foods in a walk-in cooler, they've got to have their own space identified by tags, because when we go in and we're inspecting one of the mobile food units, we got to know where they are storing their stuff. And so they have to identify, but this creates problems because if somebody's got this space down here, say on the 3rd shelf below the 4th shelf, and somebody up here on the 4th shelf put a bunch of raw hamburger or something, and then you got vegetables down here, and that stuff starts dripping down there, that's something that we have to be cognizant of and correct. But you got somebody from another operation that's impacting an operation that has nothing to do with what they're storing there. So it gets complicated at times. This is actually a picture from a commissary that opened in Raleigh on South Wilmington Street. That's it pretty much is much like the original Will and Pops in Durham station concept. You see how large it is. It's got more space in it than any of our commissaries. Hookups for trucks that don't have a space to keep their trucks. This is very important. This also creates a problem for us sometimes in that they'll pull in and hook up to the electrical supply here and keep food on these trucks sometimes. And it's not such a big deal if it's late at night because the refrigeration can handle the temperatures inside. But if they park this thing at 2 o'clock in the afternoon, 3 o'clock in the afternoon, the sun beats down on it, the temperature goes up to 120 degrees. That refrigeration is not going to work right in there. So this is something that we have to keep our eye on as well. This is just a dump station. They have to have a place to dump their gray water. They pull up and they dump their gray water. There's fresh water. They refill their freshwater tanks. This is a more traditional looking commissary that's in Durham on Driver Street. And if you look at this equipment, you'll see things like this table right here has a number. So one of the challenges in a space like this is you have to separate operations by space and time. So you have to schedule time as an operator. You have to say, I have this prep table Monday, Wednesday, and Friday from 6 a.m. to 8 a.m. And no one else can be there at that time. They could be down on this opposite end, but you can't have 2 operations that are back and forth in each other's space. So scheduling is important. And this is just another example of storage, and you see these numbers on the equipment. Somebody's got this flat grill. You know, if somebody's got it scheduled, another person can't come over here and use it. And that's storage again. Unique ways of tracking this stuff. We have to track this stuff. So what we do to make sure that the operators are coming back to commissaries, we have to have proof that they're actually coming to the commissary. A lot of the newer locations have key fobs, and we can pull that information from the data that the owner has with the key fob swipes. But in the more rudimentary operations, they just have a sign-in sheet, and we watch that. I hope everybody gets a chance to look at this. I'm not going to open this link, but this is a cool site because it shows a lot of the mobile food units where they're operating at. And if you click on one of them, it will open up a menu that shows you where they're going to be at different times of the week. So you might be able to look at this, somebody that you like and go, well, heck, they're going to be close to where I am. And you can go there on Wednesday night or wherever. This is a very cool site. I invite everybody to take a look at that, Street Food Finder. Okay, in Durham County, we were having some serious problems regulating these things, pulling our hair out because the rules were not adequate to cover some of the problems we were having. One of the major problems was the commissary owners and operators said we supplied a place for them to operate from, but we are not responsible for anything after that. Well, that wasn't quite true because you had to have somebody watching to make sure that these folks were coming back and doing what they were supposed to do. They're also responsible for making sure that the equipment is up to par, the facility is up to par, it's in compliant and everything. So I had state regionals come, actually talk with the head of environmental health at the state about this. He sent a couple of people. We spent a day in one of our major commissaries. And the result of what we discussed and what we saw going on, the result was this position statement. And one of the primary things about this position statement is that it established a primary and secondary permit holder. And it says that the primary permit holder is responsible for certain things. Implementing SOPs that ensure compliance with the code, things like that, activities, watching out for activities that may lead to cross-contamination of shared food contact surfaces. Operations cannot have anybody, the food code states that you can't have anyone unnecessary to the operation in your space when you are working. And that there are reasons, public health reasons for that. If somebody gets sick from eating food in an establishment that's a shared use kitchen like this, say one mobile food unit goes out and a bunch of people get sick, but if they're commingling everything, how do you know where it came from? You got to shut everybody down. Everybody has to stop until we figure out what's going on. If they keep it separated, then we can isolate it quicker. We've already talked about that. These are just examples of permit conditions. You can you can condition permits, and it gives you something to fall back on. If you have an operator that's not doing what they're supposed to do, you can pull their permit up and say, this is a condition of your permit. If you don't start doing this, then we're going to suspend your permit. So we run into dilemmas. What are you going to do if someone submits an application and indicates that they want to operate exclusively in another county? We can't cross county boundaries, and we don't want to. So I can't drive over to Wake County and inspect a mobile food unit that's based in Durham but works solely in Wake County. So what we do is condition the permits now that they operate at least a few days a month in Durham County so we can catch them while they're operating. You can inspect them, and we do inspect them. You should inspect them at the commissary from time to time, but you also need to catch them in the field. I don't want to dwell on a lot of this and scare people about this stuff like this does happen. This was up near Greensboro, where they had an explosion, and you can see how serious that was. Here's a couple more. There's one that was being towed down the road and caught on fire. This Philly food truck explosion, that made the news. That was a big deal. It actually was, my slide doesn't seem to be showing up very well. This was actually the highest out of court settlement in Pennsylvania history. There were a couple of people that were killed in this explosion. Some of the things that we know are falling short in our current regulations is there's nothing in North Carolina food code or fire code, excuse me, that addresses mobile food units. So it's recognized. I've had meetings with city and county fire marshal's office, and it's on our radar. We're having discussions, and they are going to implement rules that address food codes, and the fire marshal's office will be making inspections on these mobile food units eventually, but the new fire code doesn't come out until 2024. So in the meantime, we just deal with it the best we can. What are other safety concerns? CO poisoning. If you get on one of these units and it's the weather is hot or it's cool enough where they can leave windows open and that kind of thing, they're running generators. And a lot of times that exhaust flows back inside of the unit, and therefore, you're breathing that exhaust. So you got to be careful with that. They're cramped. They're very tight. They're cooking on there. There's hot surfaces everywhere. You got to be real careful when you're on these things. Some of them are packed with people. It's unreal how many people they'll put in some of these units sometimes. There's also the fact that these things aren't inspected by other agencies to make sure they're wired correctly, and those types of things. You can have electrical shock issues inside of these. How do we address this? Back in 2018, I don't know if y'all noticed, but in the earlier slide, it shows that we currently have, I believe, 189 mobile food units permitted out of Durham County. That's probably low, because if they're in a C status, which means they're not currently operating, they self-suspended. They still have a valid permit. They just can't work with it yet. And at any given time, we may have 15 or 20 units that are in C status, but they can come back out into an A status or active status anytime. They just have to call us and let us know. But this just kept getting bigger and bigger and bigger, and we did not have a handle on what was going on in these shared use kitchens. So in 2018, I requested a new position, a program specialist position. And a big part of what that specialist is, their responsibilities is to be a commissary shared use kitchen liaison. This person stays in these places. She interacts with these folks, the operators of these locations, and keeps a handle on what's going on, and goes in and periodically just observes what's happening in the establishment. And that way we're able to keep a better handle on what's happening. And it has worked out very well for us. And by the way, we are the only county in the state that has a program specialist that is designated just to the commissaries. And this person also does special food processes and variances, but a big part of what they do is just dealing with the commissaries. I threw this slide in here just because it's cool. This guy that came up with this concept, and he wanted to actually do this. He never did. He never asked to get permitted, and it does have some issues that would have to be addressed before we could permit it. But I always thought this was just a cool hot dog push cart. So I added that slide. So we went pretty fast through that. We had a lot of slides, but I breezed through it pretty fast. And that's about it. Are there any questions at this time?
Chris, I just wanted to say that was very good. Thank you so much. That whole process seems so complicated, and I imagine requires quite a bit of manpower. So are we adequately staffed for the number and the complexity of all of this?
Well, we have positions, but we're just like anybody else. We've experienced our difficulties with the Great Resignation, high turnover rates, and what you got to understand is that a registered environmental health specialist, when you hire somebody who doesn't have experience, they've got to be trained, and it's actually a drain on the folks that are already here and are experienced, because they've got to go with them. So what's happened was we've also had neighboring counties who have bumped their pay scales up very high. We've lost a lot of people to other counties. we're hoping the current class and comp addresses a lot of that. I'm hopeful. I'm really hoping that they recognize that we need some help in that respect. But you have 13 folks who are, their primary role is just inspection of these types of establishments. There are 3 more for a total of 16. Those other 3 are team leaders, and they have a smaller territory that they manage, but they help the other folks who are not up to par yet, and help them out with their territories and inspections, and they do some QA checks and stuff like that. The state expanded the QA program for food service a couple of years ago to the point where it is time consuming and very intense for us, and it takes a lot of time away from the inspections actually. So they're heavily involved in that. Then we also have the one program specialist that I said is designated to the commissaries and special processes, and then we have a person who does plan review, and that's all they do.
Okay. All right, great. Well, thank you for that. Any other comments or questions for Chris? All right, thank you. Keep up the good work.
Thank you.
All right, agenda item 7. The public health vacancy report. Any questions or comments? I see we're still in the teens. So that's the only comment I'm going to make, because last month we heard that there are folk 30 and 40%. We're good. Just keep doing what you're doing with recruiting and finding all that good talent out there and doing what we need to bring them in. So, all right, the NOV report. Any questions or comments there?
Dr. Jackson, I'll make one comment about the NOV report. We do have the new structure in place, the new color code scheme that's going to make it easier for everyone to read and understand, but we did not implement that for this report, but it will be rolling out for the next report.
Okay, all right, great, great. Thank you for that. All right, the health director's report. Any questions or comments? No. I just want to say that was health ed and community transformation. I love that, the name of that department. So yeah, that post overdose follow-up was really impressive, and working with Duke and following up with those folk who end up in the hospitals from overdoses, accidental, I guess, and or some maybe intentional. So that seems to be great work that you all are doing there. So thank you for that. And school health, that caught my eye with the training of students and staff regarding recognizing mental health triggers and signs and symptoms. So thank you, school nurses, for that. And I think that was it. And I think I saw in there that the health assessment surveys and all have started in September next year. For 2023? Okay.
That is correct. Wonderful population health division and their team, of course, in partnership with the Partnership for Healthy Durham, has done the door-to-door campaign, and they got a few finishing touches to put on it, but they have done a marvelous job with that. We have our own methodology, and it seems to work. And we look forward to providing you with the results when it's all finalized.
Okay. All right. Great. Thank you.
I had one question
Yes, Dr.
about the
Breaker.
report. When would we expect for the tooth fairy? I think it's exciting that there will be a permanent position for it, or permanent housing for it. When would that be completed?
I apologize. What 2 positions were you talking about?
The permanent housing for the tooth fairy.
Oh, already done. The county was gracious enough to purchase a site, I guess an older site, and upfitted it. It's on, I want to say Leesville Road.
Mm-hmm.
And Jim Harris and his team have already been out there, I want to say last week or maybe 2 weeks ago, and they reported back thumbs up Tooth Fairy is there. It's been outfitted with shore power, and we have a new home for our Tooth Fairy. So we're delighted about that.
I'd love to hear more about that when it's ready for us to see it.
Yeah, yeah.
Absolutely.
Thank
All
you.
right. Any other questions or comments? Okay. Committee reports, we don't have any on the agenda this month, but next month we will hear from the nominating committee.
Can I
Any-
make a short comment there
Yes.
on behalf? So Spence is the chair of the nominating committee, and he just wanted to apologize for not being able to be here today. He has internet issues. His fiber got cut or something like that, so
Oh,
he
wow.
just can't access internet. And he says that that's Josh and I and Spence are working on presenting nominations for your consideration. And if there's anyone who's interested in being a chair, then let Spence know. We'll be contacting individuals.
Yeah.
um,
It's a great
have
fun
volunteered.
position.
That's it. Thank you.
All right. Thank you all for that. All right. Any old business? Okay. All right. Under new business, we do have a couple of budget amendments. Director Jenkins.
Yes, ma'am, real brief. The first budget ordinance amendment to recognize just $2,422 from the North Carolina Department of Health and Human Services Division of Public Health Epidemiology Section and Communicable Disease Branch. The purpose of these funds is to aid in our additional funding to enhance our TB infection control program. Particularly due to our increased caseload due to our influx of Ukrainian refugees and humanitarian parolees. So we certainly are happy to receive that. And the one addition that we have is sort of a revision to recognize $12,500 from the North Carolina Department of Health and Human Services Division of Public Health. Again, this is for our tobacco-free collaborative tobacco control. And you may recall we did do one previously for $20,000. They did a revision and now we're receiving an additional $12,500. Our own Natalie Thompson serves as our regional tobacco control manager. She does a fantastic job, and these funds will assist her in her efforts. That is all I have, Madam Chair.
All right. Thank you. Any questions or comments for Director Jenkins regarding the two amendments? All right. We're always going to accept money. Anthony.
Yes, Director Jenkins. Just a quick question: for how many refugees have increased from Ukraine, and are those funds, the $2,400 or so dollars? Do you feel that is able to cover the refugees?
Couldn't give you a definite number right now, but I know it's been quite a lot to the point where we have had some additional funding in the past that have allowed us to get some temporary help. Mr. Gregorio, excellent question. As Madam Chair said, we'll take whatever we can get, but I don't think it's nearly enough. But we have been fortunate to be creative and also in our partnering with Lincoln Community Health Center to ensure that our refugee population is being taken care of. But happy to get that specific number for you and to be able to provide this board with that specific information. But I can tell you definitively that we have been serving a lot of refugees over the course of the past 6 to 8 months.
Absolutely. Well, thank you very much. And yes, any little bit helps.
Sure.
That's right. Yeah, it wasn't that long ago. We got a nice update from the refugee program.
Mhm.
So maybe, I don't know that we need another big presentation, but maybe just a small little update
Yeah.
about
Happy
how
to.
things are going from then to now, because then it was shortly after everything broke out, and see how it's changed or getting better or worse.
Indeed. Happy
Maybe
to
for next
provide that
time.
update.
Yeah, briefly. Okay. All right. Okay, so if there are no further questions or comments regarding the two amendments, I'll entertain a motion to approve them both.
So moved.
Second.
Second.
Okay. Roll call vote?
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Mr. Gregorio.
Yes.
Thank you.
Thank you. Motion carries. Any discussion about anything that anybody wants to bring up?
Madam Chair, if I may, there are agenda items for next meeting.
Since it's December and Christmas, we'll let the staff decide what they want us to know for the last meeting in this calendar year.
We
Unless
certainly
anybody
have-
else has something there they really wanted to hear about.
we certainly have a couple of things that we must present to this board. Number one being the annual communicable disease report.
Okay,
We have to provide that to you. That's normally very straightforward, normally presented by our medical director, Dr. Jeff Jinks.
okay,
And we also have our 2021 State of the County Health Report, affectionately known as the SOCH, and our county health rankings. And our Population Health Division Director, Marissa Mortarboy, and team, they should be reporting that. So again, both
Okay.
are pretty straightforward.
yeah, that sounds good.
Mhm.
All right, thank you.
Absolutely.
All right, any other questions, comments? Anything for the good of the group? All right, well, I'm gonna stand in your way no longer to get you started on your long weekend, well-deserved break and celebration for Veterans Day. So if there's nothing further, I'll entertain a motion to adjourn.
So moved.
Motion.
Who said it first?
McDougal, I'm sorry.
Okay.
This is
Who said
Gene,
it
I'll
second?
I'll
Oh,
second.
yeah, Miller. Oh, no, Jean, okay. All right, roll call vote?
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
Thank you.
All right, and enjoy your Thanksgiving. Hope you all have